All righty. Welcome to Nurse Ed Scholar. Tonight I came on because, I wanted to do an NCLEX style case study, because I really, when I say in my videos, I really want people to just not review information. I really want you to think like the NCLEX. So tonight we're going to walk through an NCLEX style case study so you can actually understand how to choose the next best action. We're going to focus on endocrine emergencies. I did a video on DKA versus HHS, so I'm going to use that to help you kind of think through step by step using the clinical judgment model, because you're really not supposed to memorize. I mean, I guess you have to memorize, but it's it, it's like you have to read, understand, comprehend, apply the information. So I guess in a part you're memorizing, but it's really more gathering information and learning how to apply it in nursing. So, even if you're watching this in the replay in the future, it'll still help you. Because as you watch it, just go through, pause, actively think through each step before I explain it. And you really ask yourself, what are you noticing? What is dangerous based on the information that you're given? And what would you do first? Because that's really how you pass the NCLEX. So before we kind of jump into the case, let's just kind of ground ourselves in how the NCLEX is actually testing you. I don't want to say every, so let's just say most next gen questions or cases is built around 6 steps, and that's the clinical judgment model. And so we're going to move through these steps together with this case study. And so, number one is recognizing cues, two, analyzing cues, then, of course, prioritizing, creating or generating solutions, and then taking action on those solutions, and then evaluating outcomes. What happens a lot of times with students is that, I mean, you get the recognizing, like you're recognizing, you're knowing something is actually wrong, right? And once something is done, that you have to evaluate it. You have to say, okay, hey, what I did, the interventions that I performed on the patient, did it really work? But the problem with students is that middle. So you think of it like a sandwich, recognizing cues is at the top, evaluating at the bottom, but you have all of this stuff in the middle. And that's where students get all jumbled up. But if you follow the clinical judgment model, it should help you to stop guessing and really start thinking like the NCLEX. So let's start. All right. So, in this case, we have a 56-year-old male. He has type 2 diabetes, and he presents with he's confused, he's weak, he has a glucose of 720. You notice on your assessment he has dry mucous membranes. They take some blood work. He has a high serum osmolality. Malacity. Oh my God. His heart rate is 118, so he's tacking, and he's hypotensive, so he's 88 over 54. So let's think about what this case is about, what you're being given as the information to figure out what's wrong with your patient. So let's slow down. So step one, recognizing cues. Let's slow it down and let's look at this how the NCLEX, wants you to. So he's a diabetic, type 2 diabetic. You know that he has an elevated glucose. He has severe hypoglycemia, with a 720 glucose. He's confused. He's disoriented. He's weak. And so, he's got some neurological changes. And we talked about dehydration. He has signs of it. He has those dry mucous membranes. But on top of that, he's tagging. I mean, his heart rate 118, his blood pressure is low. So you can tell just by the vital signs, hey, this patient appears that he is dehydrated. But the problem is that students, they make the mistake of not really seeing that this is a system-wide issue, problem. This is affecting perfusion because he's tagging, he's hypotensive, and it's affecting his brain. So he's got some neurological changes. So let's see how we're going to analyze this. And you'll realize, a lot of times I say the same thing kind of twice over and over again, but that's just to kind of reinforce what we're going through. So step two, we're analyzing the cues. Now, what do these cues, what's this information that you're gathering? What does it really mean? Remember that this patient had severe hyperglycemia, 720, he's dehydrated, and he's having some neurological changes. So let's interpret this, right? So glucose, 720. Now this is not mild. This is severe. This is severe hyperglycemia. So you're going to be doing something, right? Dehydration, it tells you for some reason fluid is just being pulled out of the body. So you're going to have to act on that, right? What are we going to do? And then he's confused. That lets you know that, like, okay, so is he perfusing to his brain? Because he's having, decreased cerebral perfusion. Or is this some kind of electrolyte imbalance? So you're trying to gather all this information and analyze what you have. So, the key here is that the glucose is high. It's high. And one thing that you have to remember is that water follows glucose out of the cells. And this is actually what's causing the dehydration in this individual. So, he's not just hyperglycemic, he's actually volume depleted and it's affecting him neurologically. All righty. So now we've analyzed. So let's go on to prioritize. So what, you know, what is this? Is this DKA, diabetic ketoacidosis, or is this HHS, hyperosmolar hyperglycemic state? What are we actually dealing with? Now, remember, uh, you're thinking, what What is this most likely condition? Is it DKA? Is it HHS? So let's kind of look at everything again. The gentleman had type 2 diabetes. That's more associated with HHS. DKA is typically with type 1. His glucose is greater than 600. That also points to HHS. And it didn't mention any Kussmaul's breathing or acidosis, and those are seen with DKA. So, of course, now the best answer is hyperosmolar hyperglycemic state. And you have to remember in HHS, the patient has enough insulin to prevent ketone formation, but it's not enough to control glucose. So the glucose rises extremely high, and this leads to the severe dehydration because remember, the glucose is being pulled out of the cells, and this is causing neurological symptoms in your patient. Okay, let's see what else I have. And so, like we said, the answer is HHS. Now, remember, like I said before, in DKA, the patient will present with, they'll have ketones, and then the ketones create acidosis. So the patient will have metabolic acidosis and it's rapid onset. Remember in HHS, it involves severe hyperglycemia, extreme dehydration, and it's a gradual onset. So The primary issue here for this patient is dehydration, not actually acidosis. Doesn't have any ketones, right? And what is the most life-threatening? It's not really the glucose. I mean, it's high, yes, but it's the severe dehydration and the poor perfusion. Hopefully, this is starting to make some sense to you. So, we need to generate solutions. What in the world are we going to do? Um, are you going to start insulin? The glucose is high. Are you going to start IV fluids? Are you going to give potassium? Are you going to give the patient oxygen? Okay. Now, some students may get confused. You know how, like, when you answer a test, two questions are really, they're not right. And then two questions are like, could be either or. What do we do first? This is priority. And the answer would be, hey, we're going to give IV fluids. And we're choosing IV fluids because the patient is severely dehydrated. And like I said before, and remember this, high glucose pulls water out of the cells. It causes massive fluid loss. So before you do anything with this patient, you're going to restore their circulating volume. Um, because remember, the blood pressure is low. What was the systolic? 88. The heart rate was high. What was it? 118. And so you know that the perfusion is compromised. So we have to restore that. If we start with insulin, we're going to worsen the hypotension because we're going to be causing rapid sodium and water retention. So we're gonna make the patient worse actually if we're going to give them insulin first. So first we're going to replenish them. We're going to give them fluids. We're going to restore the circulation. That's going to improve the kidney function because the patient is extremely dehydrated, right? And then we'll start safely lowering the glucose because remember the person has enough insulin. Okay. Oh, I'm a little behind. So fluids first, and we've talked about this. Patient severely dehydrated. We're going to give them fluids. We're going to restore the circulation, like I just said, and improve their kidney function. I was a little behind or a little ahead. All righty. So why not the other answers? So we wouldn't give the insulin first. Nope. Because, as I said, it causes rapid fluid shifts. It worsens the hypotension. It's just, like I said, the patient already has enough insulin. That's not the issue. The issue is that the patient is extremely dehydrated. Potassium, yes, there could be a shift in the potassium. It's important, but it's not the priority. The priority is to restore the circulation in your patient. And oxygen, there was no evidence that the patient had an oxygenation issue or they were in any kind of respiratory distress. You know, the NCLEX wants you to recognize that you need to fix the circulation before correcting the glucose. And I hope all of this is kind of making some sense. Now, five, we've gathered all this information. Now we're taking action. And we've already talked about what the priority is on this patient. We are going to give them IV fluids to restore their circulation, improve kidney function. And then as that's occurring, you may see some orders to start giving the patient some insulin. We are going to watch out for the electrolytes. We're going to watch out for hypokalemia because now there's going to be a shifting of potassium in the bloodstream back into the cells. So that's going to cause hypokalemia. And, we're going to, assess the patient's neural status because they were confused at the beginning of this scenario. So let's repeat it one more time. Your patient has HHS. We are going to give fluids first. We're going to restore perfusion. We're going to improve that kidney function. Second, we're going to give insulin and bring that glucose down safely. We are going to watch out for their electrolytes, and that's so important with labs. Your patient in the hospital is going to get labs. You really need to be on top of those labs, especially if you know that you should be expecting um, to be viewing their labs because you know with this patient, hey, that's going to affect their potassium. So every potassium, you're going to look for a trend and see how the potassium is shifting and see if you have to make a call to the provider. And then, of course, you're going to be checking neural status on your patient because, like I said, they were confused at the beginning of this scenario. Remember, like, none of this is really random. I mean, it is physiologically driven. Okay. So that's why we always say you can't really just memorize stuff. You have to understand it. You have to comprehend and really think about what you're doing and why you're doing it. Because memorization is only going to take you so far. Now we've done all of these things. So this is the last part of that sandwich that I kind of mentioned earlier. It's evaluating. Students know, okay, I've done something. Now I have to see if it works. So with this patient, you know, how do you know? How do you know that this patient is improving? And we've said a lot of things, right? Uh, we said that the patient was confused. So if the patient was confused and you see an improvement in their level of consciousness, well, you know that the patient is improving. They're getting better with the interventions that were given. uh, you'll notice their glucose decreasing. So you'll be checking lab work, you'll be taking blood glucose monitoring. And so you should start noticing once that patient is starting to be hydrated that their glucose will be decreasing, their hydration will improve. How do you know? The heart rate is going to decrease. It was 118. Once you fill them up, and with fluid, that should decrease, and the blood pressure should stabilize. What was it, 88 over 54? So that should improve as well. That should start stabilizing. And that is how you know your treatment and your interventions that you're doing are actually working. The patient is going to have better mental clarity. They're going to have, their glucose, like we said, is going to start reducing. It's not going to be like, it's not going to go from 700 to 100 like quickly, but you definitely don't want to do that to your patient. But you're going to start seeing it gradually go down. The patient is going to improve. And like I said, you're going to see improved hydration based on your vital signs. That's why vital signs are so important. That's why when something is going wrong with your patient, you're calling the provider, and the provider's going to say, well, what did you do? You're going to have to tell them an assessment. You're going to have to tell them some vital signs because you are the eyes and ears for the provider, and you have to tell them a story on how the patient is presenting at that time. And one thing, I just said you really don't want to drop that person's glucose quickly, because you'll put that patient in at risk for cerebral edema. Remember that fluid shift. So glucose leaves, you start giving the person some insulin and kind of controlling it, and then it shifts it back. It may put your patient at risk for having cerebral edema. Think about it. You're like, man, there's so many things, and all I had to do was give this patient some IV fluids. Sometimes the most aggressive treatment isn't the best. We have to choose the safest route and the most stabilizing first. And I know you're saying, well, I don't write orders, and we don't as nurses. However, you may have a provider who has been sleepy and tired, and he just, and or he or she or they may have just made a mistake. And so that's why it's so important for us to kind of know, disease processes and know, hey, if they write an incorrect order or they write the order. Like just say they wrote insulin first, and you're like, no, I know this person doesn't need insulin; they need fluids. You could just say, hey, did you really you wrote insulin, but did you forget to write some, an order for some fluids too? And so that's why it's so important to know these diagnoses. Now, let's change this up a little bit. Um, we were talking about HHS. And so now let's switch it. Now, you have a patient and now they're having Kussmaul's respirations. Uh, they're breathing 28 times a minute, deep and rapid. You notice a fruity um, odor, like breath odor. And they take some ABGs and their pH is 7.2. What has changed? Well, the cool smalls breathing, the big one of the clues is okay, you have fruity breath that's coming from those ketones. They took some ABGs and now it's 7.2, so the person's in acidosis. So the cool smalls breathing is compensating for the acidosis. Um, they are trying to blow off the acid, the CO2. And so that's why they're breathing deep and rapid. They are trying to um, counteract the effects of that acidosis. So hopefully that's making sense. And so we have DKA. So that's the other side. You know, um, like I said, the ketones are causing metabolic acidosis. The DKA, the pH at 7.2. Um, with DKA, there isn't any insulin. Okay. And that's why I mentioned type 1 diabetics. There isn't any insulin, so the glucose can't go into the cells. And so, what does the body do? The body is breaking down fat for energy, it's creating ketones. The ketones are causing the metabolic acidosis. And like I said, the lungs, they're breathing to try to blow off that the acidosis and try to correct that the metabolic acidosis that the patient is actually experiencing. And this is really how the NCLEX test you. They may not change everything. They're giving you a scenario and they may just change one little key. And you see how you went from dehydration with HHS to acidosis you know, um, with DKA just by changing just a few um, signs and symptoms of your patient. And that's what the NCLEX does. And so, the key takeaways from this live was really to kind of show you how to go through each step of the clinical judgment model and just to kind of reinforce DKA and HHS, knowing that DKA, diabetic ketoacidosis, is an acid problem, and HHS is a dehydration um, problem. So, you know, remember that HHS, the person needs fluids. I mean, DKA, the patient's going to need fluids too, but they're going to also need some insulin. And, if you kind of remember those things, it really should help you um, from uh, from time to time, when you're really, trying to figure out what do I do with my patient? Because we're really not trying to guess. Guessing can be dangerous. And that's why we go through the clinical judgment model. And that's why we talk about trends and that's why we talk about patterns. Because, the NCLEX is not going to ask you, what do you know? It's going to ask you, what would you do first? And the clinical judgment model and that step by step would really help you figure out what is the priority, what is the most important, what is the safest thing that I can do to help my patient and change um, their condition, and then advocating for them and making sure, hey, is the provider actually writing all of the orders that would benefit your patient, because, like I said, you are the eyes and ears of your patient, right? And so that's it. Thank you for watching this endocrine emergency DKA versus HHS on Nurse Ed Scholar Live. If you like this video, please subscribe. To sign up for more. I'm gonna still do, my regular traditional videos, but I am gonna come on live every now and then. I think it's good that we talk through scenarios. I find that students have a difficult time just trying to figure out, what am I recognizing, and, what does it mean, and, how do I prioritize what I do first, and then what do I do first, and then, okay, now that it's done, how do I evaluate it? And so I think this will help with, um, critical thinking skills. And a lot of times that's where students are having problems. So I'll see you in the next lesson, and happy studying from Nurse Ed Scholar.